Phlebotomy Exam Review 2026 with answers. Question 1. Which of the following tubes contains an additive that preserves glucose levels for up to 3 days? Option A, gray top, sodium fluoride. Option B, light blue top. Option C, lavender top. Option D, green top. The correct answer is option A, gray top, sodium fluoride. Gray tubes containing sodium fluoride preserve glucose by inhibiting glycolysis for an extended period. This helps maintain glucose concentration when processing may be delayed. Other tube types do not provide the same glucose stabilizing additive. Question 2. Which of the following parameters is most heavily altered if a potassium sample is hemolyzed? Option A. The potassium level will be falsely elevated. Option B. The potassium level will be falsely decreased. Option C. The sodium level will rise to compensate. Option D. The hematocrit level will drop below readable thresholds. The correct answer is option A. The potassium level will be falsely elevated. Hemolysis releases intracellular potassium from red blood cells into the serum or plasma. This produces a falsely elevated potassium result that can appear clinically dangerous. Sodium and hematocrit are not affected in the same direct way by red cell rupture in a chemistry sample. Question 3. What is the maximum amount of time a tourniquet should remain tied on a patient's arm during a venipuncture? Option A, 30 seconds. Option B, 1 minute. Option C, 2 minutes. Option D, 3 minutes. The correct answer is option B, 1 minute. Tourniquet time should generally be limited to 1 minute to prevent venous stasis and hemoconcentration. Longer application can concentrate proteins, cells, potassium, calcium, and other analytes. Releasing and reapplying after a pause is safer than leaving it tied while searching for a vein. Question 4. What is the correct order of draw for a multitube venipuncture sequence involving a coagulation tube, a blood culture, and a hematology tube? Option A, light blue, blood culture, lavender. Option B, blood culture, light blue, lavender. Option C, lavender, light blue, blood culture. Option D, blood culture, lavender, light blue. The correct answer is option B, blood culture, light blue, lavender. Blood cultures are collected first to maintain sterility, followed by light blue coagulation tubes and then lavender hematology tubes. This order reduces contamination and additive carryover. Drawing EDTA before citrate can interfere with coagulation results. Question 5. What constitutes a proper unique identifier sequence for an inpatient according to the Joint Commission? Option A, full name and room number. Option B, full name and date of birth. Option C, attending physician and bed number. Option D, date of birth and diagnosis. The correct answer is option B, full name and date of birth. 2 reliable identifiers are required to link the specimen to the intended patient. Full name and date of birth are acceptable because they identify the person rather than the location. Room number, bed number, diagnosis, or physician name can change and should not be used as primary identifiers. Question 6. Which of the following parameters can cause a false elevation in a patient's serum bilirubin level? Option A, exposing the specimen tube to direct room light or sunlight for an hour. Option B, ensuring the specimen is kept away from light by wrapping it in foil. Option C, centrifuging the specimen within 30 minutes of collection. Option D, collecting the sample from a fasting patient. The correct answer is option D, collecting the sample from a fasting patient. Fasting can increase serum bilirubin in some patients by altering bilirubin metabolism and hepatic handling. Light exposure usually lowers bilirubin by photodegradation, so it would not cause a false elevation. Proper bilirubin handling includes following preparation instructions and protecting the specimen from light. Question 7. When performing venipuncture, the needle should be inserted with the bevel facing in which direction? Option A, facing downward. Option B, facing upward. Option C, facing to the left. Option D, facing to the right. The correct answer is option B, facing upward. The bevel should face upward so the sharpest edge enters the skin and vein smoothly. This orientation reduces tissue trauma and improves the likelihood of entering the venous lumen. Turning the bevel down or sideways can make insertion more painful and less controlled. Question 8. If a patient is receiving an intravenous 4. infusion in the right arm, where should the phlebotomist attempt to draw blood? Option A. Directly from the foreline itself. Option B. From the left arm. Option C. Above the foresight on the right arm. Option D. From the hand on the right arm. The correct answer is option B. From the left arm. Drawing from the opposite arm avoids dilution or contamination from the fore-infusion. For fluids, medications, and additives can alter test results if sampled from the same side. Drawing directly from the line or above the infusion site requires special authorization and is not routine phlebotomy practice. Question 9. What is the primary purpose of applying a tourniquet during a venipuncture procedure? Option A. To stop the arterial blood flow to the limb. Option B. To engorge the veins and make them more palpable. Option C. To anchor the vein and prevent it from rolling. Option D. To ensure the sterility of the puncture site. The correct answer is option B. To engorge the veins and make them more palpable. A tourniquet temporarily slows venous return so veins become fuller, easier to see, and easier to palpate. It should not stop arterial flow or be tightened enough to injure the patient. Vein anchoring and skin antisepsis are separate steps with different purposes. Question 10. What is the correct angle of insertion for a standard multisample needle during a venipuncture? Option A. 5 to 10 degrees. Option B. 15 to 30 degrees. Option C. 45 to 60 degrees. Option D. 90 degrees. The correct answer is option B. 15 to 30 degrees. A standard straight needle is usually inserted at a shallow 15 to 30 degree angle to enter the vein smoothly. This angle helps avoid passing through the vein or striking deeper structures. Very shallow angles can miss the lumen, while steep angles increase tissue trauma. Question 11. Which of the following tests requires a 24-hour urine collection? Option A. Culture and sensitivity, C and S. Option B. Creatinine clearance. Option C. Routine chemical urinalysis. Option D. Pregnancy HCG confirmation. The correct answer is option B. Creatinine clearance. Creatinine clearance testing often requires a 24-hour urine collection to measure renal clearance over time. The timed urine result is usually paired with a blood creatinine level. Routine urinalysis, pregnancy testing, and cultures use different urine collection methods. Question 12. Which of the following actions can lead to a false elevation in a patient's serum potassium level? Option A. Releasing the tourniquet within 1 minute of needle insertion. Option B. Keeping the patient's arm down during the venipuncture procedure. Option C. Allowing the patient to pump their fist repeatedly before and during the draw. Option D. Transporting the specimen to the laboratory within 30 minutes. The correct answer is option C. Allowing the patient to pump their fist repeatedly before and during the draw. Repeated fist pumping can falsely elevate serum potassium by promoting local muscle activity and hemoconcentration. Potassium may shift out of cells or become concentrated in the specimen. A relaxed fist without pumping is preferred during routine venipuncture. Question 13. What color top tube contains the additive EDTA and is the primary tube used for a complete blood count? CBC. Option A. Lavender top. Option B. Light blue top. Option C. Green top. Option D. Gray top. The correct answer is option A. Lavender top. Lavender tubes contain EDTA and are the primary tubes for CBC testing. EDTA prevents clotting while preserving blood cells for accurate counts. Serum or heparin tubes do not provide the standard specimen required for routine CBC analysis. Question 14. What should a phlebotomist do immediately after activating the safety device on a used venipuncture needle? Option A. Place the needle assembly into a rigid, leak-proof sharps container located near the point of use. Option B. Drop the needle into a biohazard waste bag with blood-stained gauze. Option C. Set the needle down on the patient's bedside table until the tubes are fully labeled. Option D. Detach the needle from the tube holder adapter and place only the needle into the sharps container. The correct answer is option A. Place the needle assembly into a rigid, leak-proof sharps container located near the point of use. After the safety device is activated, the used needle assembly should go directly into a rigid, leak-proof sharps container near the point of use. Immediate disposal minimizes handling and needle stick risk. Needles should not be recapped, carried around, or placed in regular trash. Question 15. What is the function of the thixotropic gel inside an SST or PSD tube? Option A. To accelerate the coagulation cascade. Option B. To form a physical barrier between cells and serum/plasma during centrifugation. Option C. To preserve glucose levels for up to 24 hours. Option D. To chelate calcium and prevent fibrin formation. The correct answer is option B. To form a physical barrier between cells and serum/plasma during centrifugation. Thixotropic gel moves during centrifugation to create a stable barrier between the cells and the serum or plasma. This separation limits ongoing cellular metabolism and analyte exchange after spinning. The gel does not act as the anticoagulant or the clot activator. Question 16. What type of patient environment requires protective, reverse, isolation protocols? Option A. A patient with an active, contagious respiratory flu virus. Option B. A patient with an open, draining MRSA wound infection. Option C. A patient with a severely compromised immune system, such as a recent bone marrow transplant recipient. Option D. A patient with suspected food poisoning or viral gastroenteritis. The correct answer is option C. A patient with a severely compromised immune system, such as a recent bone marrow transplant recipient. Protective or reverse isolation is used for patients with severely weakened immune systems. The goal is to protect the patient from microorganisms carried by staff, visitors, and the environment. Patients with contagious infections generally require standard, contact, droplet, or airborne precautions instead. Question 17. Which of the following tubes contains no additives or gel barriers and is often used as a discard tube or for specialized serum testing? Option A. Clear or plain red glass top. Option B. Light blue top. Option C. Lavender top. Option D. Light green top. The correct answer is option A. Clear or plain red glass top. Clear or plain red glass tubes contain no additive or gel and may be used as discard tubes or for selected serum testing. They are useful when additive carryover must be avoided. Colored additive tubes contain substances that can interfere with tests not designed for them. Question 18. Which of the following is an example of an engineering control designed to reduce the risk of needle stick injuries? Option A. Wearing a laboratory coat. Option B. Utilizing self-sheathing safety needles. Option C. Hand washing after every procedure. Option D. Disposing of waste in a biohazard trash bag. The correct answer is option B. Utilizing self-sheathing safety needles. Engineering controls are built-in safety devices that reduce exposure risk by design. Self-sheathing or safety-engineered needles help prevent needle stick injuries after use. Lab coats and hand hygiene are work practice or PPE measures, not engineering controls. Question 19. What is the primary clinical reason for avoiding the basilic vein whenever possible? Option A. It is too small to yield an adequate sample. Option B. It is located near the brachial artery and median nerve. Option C. It has a high tendency to collapse under low pressure. Option D. It contains valves that prevent blood flow into the tube. The correct answer is option B. It is located near the brachial artery and median nerve. The basilic vein lies close to the brachial artery and median nerve on the medial side of the arm. Accidental injury in this area can cause severe bleeding, nerve pain, or other complications. It is used only when safer veins are unavailable and the practitioner is confident in the site. Question 20. Specimen tubes must be labeled at what point during the collection process? Option A. Prior to entering the patient's room. Option B. Immediately after drawing the blood, before leaving the patient's side. Option C. At the central processing lab desk. Option D. after the specimen has finished centrifuging. The correct answer is option B, immediately after drawing the blood, before leaving the patient's side. Specimens must be labeled immediately after collection while still at the patient's side. This practice prevents mix-ups between patients, rooms, or batches of tubes. Pre-labeling tubes or labeling later at the desk creates a serious wrong patient risk. Question 21. Chain of custody protocols are required for which type of laboratory specimens? Option A, routine lipid panels. Option B, therapeutic drug monitoring. Option C, paternity and forensic drug testing. Option D, blood cultures for sepsis. The correct answer is option C, paternity and forensic drug testing. Chain of custody is required when the specimen may be used as legal evidence or to establish identity. Forensic drug testing and paternity testing require documentation of collection, handling, transfer, and receipt. Routine clinical tests do not usually require that level of legal tracking. Question 22. Which of the following additives is found in a yellow top tube used for human leukocyte antigen, HLA, typing or DNA studies? Option A, sodium polyant whole sulfonate, SPS. Option B, acid citrate dextrose, ACD. Option C, sodium citrate. Option D, potassium oxalate. The correct answer is option B, acid citrate dextrose, ACD. Yellow ACD tubes contain acid citrate dextrose and are used for HLA typing, DNA studies, and some cellular testing. ACD preserves cells by anticoagulating the specimen while supporting cell viability. SPS yellow tubes are intended for blood cultures and have a different additive. Question 23. What is the clinical term for an increase in the total number of circulating red blood cells? Option A, anemia. Option B, polycythemia. Option C, leukemia. Option D, thrombocytopenia. The correct answer is option B, polycythemia. Polycythemia means an increased total number of circulating red blood cells or increased red cell mass. It can thicken blood and increase thrombotic risk depending on cause. Anemia is decreased red cell or hemoglobin concentration. Question 24. Which of the following veins is located on the outer thumb side of the arm and is the third choice for venipuncture? Option A, cephalic vein. Option B, basilic vein. Option C, median cubital vein. Option D, brachial vein. The correct answer is option A, cephalic vein. The cephalic vein lies on the lateral, thumb side of the arm and is often a later choice for venipuncture. It may be more difficult to anchor and access than the median cubital vein. The basilic vein is medial and carries greater nerve and artery risk. Question 25. Hemoconcentration can be caused by which of the following actions? Option A, leaving the tourniquet on for longer than 1 minute. Option B, using a needle that is too small for the vein. Option C, inverting the collection tubes too slowly. Option D, puncturing the skin before the alcohol is dry. The correct answer is option A, leaving the tourniquet on for longer than 1 minute. Prolonged tourniquet application traps blood in the limb and allows fluid to shift out of the vessels. This concentrates cells and analytes, producing hemoconcentration and potentially misleading results. Needle size, tube inversion speed, and wet alcohol cause different specimen problems such as hemolysis or contamination. Question 26. A fasting specimen requires that the patient does not consume food or beverages, except water, for how many hours prior to collection? Option A, 2 to 4 hours. Option B, 4 to 6 hours. Option C, 8 to 12 hours. Option D, 18 to 24 hours. The correct answer is option C, 8 to 12 hours. Many fasting specimens require 8 to 12 hours without food or beverages other than water. This window helps remove recent dietary effects on glucose, lipids, and related analytes. Shorter fasting may not stabilize results, while much longer fasting can create other metabolic changes. Question 27. Which analytical error is categorized as a pre-examination, pre-analytical error? Option A, miscalibrating a chemistry analyzer machine. Option B, misidentifying a patient before collecting their sample. Option C, misinterpreting a reading on a microscopic smear sheet. Option D, delays in transmitting finalized electronic reports to the doctor. The correct answer is option B, misidentifying a patient before collecting their sample. Misidentifying a patient before collection is a pre-examination error because it occurs before the specimen is analyzed. Pre-analytical errors often have the greatest impact on patient safety because the wrong sample can produce a believable but unsafe result. Analyzer calibration and report transmission belong to later phases. Question 28. Which vein is considered the first choice for venipuncture in the antecubital fossa? Option A, basilic vein. Option B, cephalic vein. Option C, median cubital vein. Option D, brachial vein. The correct answer is option C, median cubital vein. The median cubital vein is usually preferred because it is large, well anchored, and less likely to roll. It also lies farther from major nerves and arteries than the basilic vein. The cephalic vein can be used when necessary, but it is often less stable and more difficult to access. Question 29. Which of the following tests is part of a routine liver function panel? Option A, creatinine. Option B, alanine aminotransferase, ALT. Option C, hemoglobin A1c. Option D, troponin I. The correct answer is option B, alanine aminotransferase, ALT. ALT is a liver-associated enzyme included in routine liver function evaluation. It helps assess hepatocellular injury when interpreted with other liver markers. Creatinine, HbA1c, and troponin are associated with kidney function, glucose control, and cardiac injury rather than a standard liver panel. Question 30. What type of protective equipment must be worn when performing a venipuncture on a patient with droplet precautions? Option A, an N95 respirator mask and shoe covers. Option B, a standard surgical mask and gloves. Option C, a full-body Tyvek suit and goggles. Option D, no personal protective equipment is required. The correct answer is option B, a standard surgical mask and gloves. Droplet precautions require a surgical mask, and gloves are used for venipuncture under standard precautions. The mask protects mucous membranes from large respiratory droplets during close contact. N95 respirators are reserved for airborne precautions. Question 31. Which of the following conditions describes a vein that feels hard, cord-like, and lacks resiliency? Option A, patent vein. Option B, sclerosed vein. Option C, superficial vein. Option D, tortuous vein. The correct answer is option B, sclerosed vein. A sclerosed vein feels hard, cord-like, and poorly resilient because of scarring or repeated irritation. Such veins may not accept a needle well and can yield poor flow. A patent vein is open and resilient, while tortuous veins are winding rather than necessarily hardened. Question 32. A phlebotomist enters a room to draw blood from an inpatient but notices the patient does not have an identification band attached to their body. What is the proper course of action? Option A, draw the blood anyway and ask the patient to state their name. Option B, look for the ID band on the nightstand or 4-pole and scan it. Option C, refuse to draw the blood until a nurse attaches a new ID band to the patient. Option D, verify identity using the chart at the foot of the bed and complete the draw. The correct answer is option C, refuse to draw the blood until a nurse attaches a new ID band to the patient. An inpatient must have an identification band attached to the body before routine collection. A band on a table, bed rail, or 4-pole cannot prove the patient's identity. Nursing staff should replace or verify the band before the phlebotomist proceeds. Question 33. Which of the following statements matches the correct definition of assault? Option A, unjustified or unconsented physical contact with another person. Option B, the intentional threat or attempt to cause bodily harm, creating fear in the patient. Option C, revealing confidential medical findings to unauthorized personnel. Option D, mislabeling a laboratory specimen tube by accident. The correct answer is option B, the intentional threat or attempt to cause bodily harm, creating fear in the patient. Assault is an intentional threat or attempt that makes a patient fear harmful contact. No physical touching is required for assault to occur. Battery involves unauthorized touching, and confidentiality breaches involve private information rather than threatened harm. Question 34. What is the target population for a GA3 card or newborn screening test panel? Option A, geriatric outpatients in nursing homes. Option B, infants up to a few days or weeks old. Option C, pregnant women in their first trimester. Option D, patients undergoing active chemotherapy treatments. The correct answer is option B, infants up to a few days or weeks old. GA3 cards and newborn screening panels are designed for infants shortly after birth. They screen for metabolic, endocrine, and genetic conditions that benefit from early detection. Adult, prenatal, or oncology testing uses different screening methods. Question 35. Which of the following options defines the proper location for a dermal puncture on an infant's heel? Option A, the posterior curvature of the heel directly over the calcaneus bone. Option B, the medial or lateral margins of the plantar surface of the heel. Option C, the central arch area of the foot pad. Option D, the tips of the smaller toes. The correct answer is option B, the medial or lateral margins of the plantar surface of the heel. Infant heel punctures should be performed on the medial or lateral plantar margins of the heel. These sites reduce the chance of striking the calcaneus and provide suitable capillary blood. The arch, posterior heel, and toes are unsafe for routine newborn heel sticks. Question 36. How many times should a light blue top tube be inverted immediately after collection? Option F, 1 to 2 times. Option B, 3 to 4 times. Option C, 5 to 8 times. Option D, 10 to 12 times. The correct answer is option B, 3 to 4 times. Light blue citrate tubes should be gently inverted 3 to 4 times after filling. This distributes the anticoagulant without damaging cells or activating clotting. Too few inversions can allow clot formation, while vigorous shaking can cause hemolysis. Question 37. What clinical term describes a hard, cord-like vein that has become occluded or blocked due to repeated inflammation or chemical irritation? Option A, sclerosed or thrombosed vein. Option B, patent vein. Option C, tortuous vein. Option D, superficial vein. The correct answer is option A, sclerosed or thrombosed vein. A sclerosed or thrombosed vein feels hard, cord-like, and may be partially or fully blocked. Repeated puncture, inflammation, or irritating infusions can produce this condition. Such veins should generally be avoided because flow is poor and injury risk is higher. Question 38. Which of the following variables can cause a specimen to appear cloudy or milky white after centrifugation? Option A, high levels of lipids, fats, circulating in the blood. Option B, extensive hemolysis from using a small needle. Option C, elevated levels of direct and indirect bilirubin. Option D, failure to mix an anticoagulant tube after drawing. The correct answer is option A, high levels of lipids, fats, circulating in the blood. High circulating lipid content produces a cloudy or milky serum or plasma appearance after centrifugation. This condition is called lipemia and may interfere with optical laboratory methods. Hemolysis creates red discoloration, while icterus creates yellow discoloration. Question 39. Which of the following tests requires a fasting specimen to ensure diagnostic accuracy? Option A, complete blood count, CBC. Option B, lipid panel and fasting blood sugar. Option C, blood culture series. Option D, prothrombin time, patient. The correct answer is option B, lipid panel and fasting blood sugar. Lipid panels and fasting blood sugar tests are strongly affected by recent food intake. Fasting helps standardize triglyceride and glucose measurements for diagnostic interpretation. CBC, blood cultures, and patient usually do not require fasting for accuracy. Question 40. If a phlebotomist notices that a patient's name on an ID band matches the requisition, but the medical record numbers are different, what should they do? Option A, draw the specimen and cross out the number on the tube label. Option B, proceed with the draw as long as the alphabetical spelling of the name is correct. Option C, do not collect the specimen until the discrepancy is resolved by admissions or nursing staff. Option D, Ask the patient which number is the correct one to use. The correct answer is option C. Do not collect the specimen until the discrepancy is resolved by admissions or nursing staff. Matching names are not enough when medical record numbers conflict. The specimen must not be collected until the discrepancy is resolved by appropriate staff. Asking the patient to choose a number or editing labels manually can create a serious identification error. Question 41. What is the appropriate antiseptic choice for blood culture site preparation in patients older than 2 months? Option A, 70% isopropyl alcohol alone. Option B, chlorhexidine gluconate or tincture of iodine. Option C, sterile saline solution. Option D, benzalkonium chloride. The correct answer is option B, chlorhexidine gluconate or tincture of iodine. Blood culture site preparation must strongly reduce skin flora to prevent false positive cultures. Chlorhexidine gluconate or tincture of iodine is commonly used for patients older than 2 months, depending on policy. Alcohol alone is not sufficient for many culture protocols, and saline is not an antiseptic. Question 42. Which of the following tubes contains a clot activator paired with a thixotropic gel barrier designed for serum separation? Option A, light green top, PSD. Option B, gold or red / black marbled top, SST. Option C, lavender top, EDTA. Option D, light blue top, sodium citrate. The correct answer is option B, gold or red / black marbled top, SST. Gold or red-black marbled SST tubes contain a clot activator and thixotropic gel for serum separation. The clot activator speeds clot formation, and the gel forms a barrier after centrifugation. PSD tubes produce plasma because they contain heparin instead of a serum clotting system. Question 43. Which of the following structures is an example of an unoxygenated blood carrier? Option A, pulmonary vein. Option B, aorta. Option C, superior vena cava. Option D, brachial artery. The correct answer is option C, superior vena cava. The superior vena cava carries deoxygenated blood from the upper body back to the right atrium. Most systemic veins carry unoxygenated blood, while most systemic arteries carry oxygenated blood away from the heart. The pulmonary vein is an exception because it carries oxygenated blood to the left atrium. Question 44. When using a butterfly winged infusion set with a light blue top tube, why must a discard tube be drawn first? Option A, to clear any residual skin surface contaminants from the needle. Option B, to purge the air out of the butterfly tubing to ensure a proper fill volume. Option C, to activate the coagulation cascade prior to sample collection. Option D, to check if the vein has adequate pressure to fill a full tube. The correct answer is option B, to purge the air out of the butterfly tubing to ensure a proper fill volume. Butterfly tubing contains air that can reduce the fill volume of the first tube collected. A discard tube removes that air so a light blue citrate tube fills to the required level. The discard is not collected to clean the needle or activate clotting. Question 45. What should the phlebotomist do immediately before applying a bandage to a venipuncture site? Option A, check the site to confirm that active bleeding has completely stopped. Option B, ask the patient to bend their elbow firmly over the gauze pad. Option C, apply a generous layer of antibiotic ointment to the wound. Option D, label the tubes using the patient's bedside charts. The correct answer is option A, check the site to confirm that active bleeding has completely stopped. The puncture site must be checked to confirm bleeding has stopped before a bandage is applied. Bandaging over active bleeding can hide continued blood loss and increase bruising. Bending the elbow can also promote hematoma formation and should not be used as pressure technique. Question 46. When collecting a blood alcohol level for legal purposes, what antiseptic should be used to cleanse the site? Option A, 70% isopropyl alcohol. Option B, tincture of iodine. Option C, chlorhexidine gluconate or soap and water. Option D, hydrogen peroxide. The correct answer is option C, chlorhexidine gluconate or soap and water. Alcohol-based skin cleansers are avoided for legal blood alcohol collections because they can raise questions about contamination. Chlorhexidine, povidone iodine, or soap and water are acceptable non-alcohol alternatives depending on policy. Routine alcohol prep pads are appropriate for many venipunctures but not for forensic alcohol testing. Question 47. Which of the following is an example of an analytical component of quality assurance? Option A. Double-checking patient identity wristbands. Option B. Ensuring proper maintenance and calibration of automated laboratory equipment. Option C. Delivering critical panic results to a physician on time. Option D. Labeling the collection tubes at the bedside. The correct answer is option B. Ensuring proper maintenance and calibration of automated laboratory equipment. Analytical quality assurance involves the testing process itself, including instrument maintenance, calibration, controls, and reagent performance. These activities ensure measured results are reliable. Patient identification and bedside labeling are pre-analytical steps, while reporting results is post-analytical. Question 48. For which of the following tests must the specimen be protected from light immediately after collection? Option A. Ammonia. Option B. Bilirubin. Option C. Lactic acid. Option D. Prothrombin. The correct answer is option B. Bilirubin. Bilirubin is light sensitive and can degrade when exposed to room light or sunlight. Protecting the tube promptly helps prevent falsely decreased bilirubin values. Ammonia and lactic acid have temperature requirements, while coagulation testing has fill and timing requirements. Question 49. What condition can occur if blood is drawn from an arm on the same side as a recent radical mastectomy? Option A. Syncope. Option B. Lymphedema and altered test results. Option C. Petechiae. Option D. Sclerosed veins. The correct answer is option B. Lymphedema and altered test results. The arm on the side of a recent radical mastectomy may have impaired lymph drainage and increased risk for swelling. Blood collection there can worsen lymphedema and may also produce altered results from compromised circulation. The unaffected arm or an approved alternate site should be used whenever possible. Question 50. Which of the following is a characteristic of arterial punctures that differentiates them from venipunctures? Option A. The blood is typically dark red or maroon. Option B. The blood will pulse spontaneously into the syringe. Option C. A tourniquet must be applied extremely tight. Option D. The angle of needle insertion is 15 degrees. The correct answer is option B. The blood will pulse spontaneously into the syringe. Arterial blood is under higher pressure and may pulse into the syringe without vacuum assistance. It is usually brighter red because it is more oxygenated. Venous blood typically flows more steadily and is collected at a shallower angle. Question 51. What should a phlebotomist do if they note a discrepancy between the patient's spelling of their last name on their wristband versus the lab order? Option A. Correct the spelling on the band using a waterproof marker. Option B. Proceed with the draw as long as the first name and birth date match perfectly. Option C. Hold the procedure and contact the nursing staff or registration to correct the identification bands before drawing blood. Option D. Assume the lab order has a typographical error and proceed with the draw. The correct answer is option C. Hold the procedure and contact the nursing staff or registration to correct the identification bands before drawing blood. A spelling mismatch between the wristband and lab order is an identification discrepancy. Collection should be held until nursing staff or registration resolves and documents the accurate identifiers. Drawing first and fixing labels later risks a wrong patient specimen. Question 52. Why is the first drop of blood wiped away during a capillary puncture? Option A. It contains skin surface bacteria. Option B. It contains tissue fluid contamination. Option C. It hemolyzes too rapidly to be accurate. Option D. It clots too quickly to be collected. The correct answer is option B. It contains tissue fluid contamination. The first drop from a skin puncture often contains tissue fluid and surface contaminants from the puncture process. Wiping it away improves specimen quality and reduces dilution of the sample. Collecting that first drop can contribute to inaccurate chemistry or hematology results. Question 53. Which additive acts as a glycolytic inhibitor in a grey top tube? Option A, sodium fluoride. Option B, lithium heparin. Option C, DDTA. Option D, thrombin. The correct answer is option A, sodium fluoride. Sodium fluoride inhibits glycolysis, slowing the breakdown of glucose by blood cells after collection. It is commonly paired with an anticoagulant in grey tubes for glucose-related testing. Heparin, EDTA, and thrombin serve different purposes and do not primarily preserve glucose. Question 54. What does the term erythema mean? Option A, redness of the skin caused by congestion or inflammation of the capillaries. Option B, a pale appearance of the skin due to low red cell counts. Option C, a bluish tint to the skin caused by a lack of oxygen. Option D, a yellowing of the skin caused by high bilirubin levels. The correct answer is option A, redness of the skin caused by congestion or inflammation of the capillaries. Erythema means redness of the skin from capillary congestion or inflammation. It may be seen with irritation, infection, allergy, or localized trauma. Pallor, cyanosis, and jaundice describe pale, blue, and yellow color changes. Question 55. A patient under contact precautions requires a blood draw. Which of the following personal protective equipment, PPE, must the phlebotomist don before entering the room? Option A, N95 respirator and gloves. Option B, gown and gloves. Option C, surgical mask and face shield. Option D, gown, mask, and goggles. The correct answer is option B, gown and gloves. Contact precautions require barrier protection against organisms spread by direct touch or contaminated surfaces. Gown and gloves protect clothing and hands before entering the room and should be removed according to facility procedure before exit. Respirators are reserved for airborne hazards, while masks and eye protection are added when splash or droplet exposure is expected. Question 56. What is the primary medical reason for avoiding the basilic vein for routine venipuncture procedures whenever possible? Option A, the vein is too small to yield an adequate sample volume. Option B, the vein is located in close anatomical proximity to the brachial artery and the median nerve. Option C, the vein has a high tendency to collapse under normal vacuum tube pressure. Option D, the vein lacks a sufficient path to the superior vena cava system. The correct answer is option B. The vein is located in close anatomical proximity to the brachial artery and the median nerve. The basilic vein is avoided for routine draws because it lies close to the brachial artery and median nerve. Injury in that area can cause significant bleeding or nerve symptoms. Safer veins should be selected first whenever they are available. Question 57. Which of the following situations can cause a false elevation in a patient's serum ammonia level? Option A, transporting the specimen to the laboratory on ice. Option B, delaying the separation of cells from the plasma beyond 15 minutes at room temperature. Option C, using a green top tube containing sodium heparin. Option D, labeling the specimen tube at the patient's bedside. The correct answer is option B, delaying the separation of cells from the plasma beyond 15 minutes at room temperature. Ammonia can rise falsely when cells remain in contact with plasma at room temperature. Prompt chilling, rapid transport, and timely separation help preserve the true value. Delays beyond recommended handling times are a major pre-analytical source of error. Question 58. Which of the following is the correct order of draw for a dermal, capillary, puncture? Option A, lavender, green, red. Option B, red, green, lavender. Option C, green, lavender, red. Option D, light blue, lavender, green. The correct answer is option A, lavender, green, red. Capillary collections prioritize EDTA specimens first because small skin puncture samples clot rapidly. Other additive tubes follow, and serum tubes are typically collected last because clotting is expected there. Using venipuncture order for capillary specimens can allow microclots to compromise hematology testing. Question 59. Which of the following is an example of an implied consent scenario? Option A patient signs a formal document for an invasive procedure. Option B, an unconscious emergency room patient requiring urgent diagnostic lab work. Option C, a patient verbally states they agree to the blood test. Option D, a parent signs a waiver for their underage child. The correct answer is option B, an unconscious emergency room patient requiring urgent diagnostic lab work. In an emergency, an unconscious patient may be treated under implied consent when urgent diagnostic information is needed. The law generally recognizes that a reasonable person would consent to necessary care to prevent harm. This differs from a signed consent form or a routine verbal agreement. Question 60. Which of the following veins runs along the lateral, outer, aspect of the antecubital fossa and is considered the second choice for venipuncture? Option A, basilic vein. Option B, cephalic vein. Option C, median cubital vein. Option D, axillary vein. The correct answer is option B, cephalic vein. The cephalic vein runs along the lateral, thumb side aspect of the antecubital area. It is often considered after the median cubital vein because it may be less anchored or harder to access. The basilic vein is medial and closer to major nerves and arteries. Question 61. What type of sample is collected during a therapeutic phlebotomy procedure? Option A tiny capillary tube for microhematocrit checking. Option B, a large unit of blood, typically 450 to 500 ml, to treat conditions like polycythemia vera. Option C, a series of 3 blood culture bottles over 24 hours. Option D, an arterial sample for gas analysis. The correct answer is option B, a large unit of blood, typically 450 to 500 ml, to treat conditions like polycythemia vera. Therapeutic phlebotomy removes a large volume of blood, often about 450 to 500 ml, to reduce red cell mass or iron burden. It may be used for conditions such as polycythemia vera or hemochromatosis under provider order. It is different from diagnostic venipuncture, which collects small specimen volumes. Question 62. What is the proper angle of insertion when using a winged infusion set, butterfly needle, to draw from a hand vein? Option A, 5 to 10 degrees. Option B, 10 to 15 degrees. Option C, 30 to 45 degrees. Option D, 60 to 90 degrees. The correct answer is option B, 10 to 15 degrees. A butterfly needle is inserted at a lower angle, often about 10 to 15 degrees, especially for superficial hand veins. The shallow angle helps enter small veins without puncturing through them. Steeper angles are more likely to cause infiltration or injury in hand veins. Question 63. Which of the following elements is critical to include on a manual handwritten specimen tube label? Option A, phlebotomist's initials, patient's full name, DOB, date, and time of collection. Option B, patient's insurance policy number and diagnosis code. Option C, phlebotomist's full signature and room number. Option D, name of the ordering physician and laboratory phone number. The correct answer is option A, phlebotomist's initials, patient's full name, DOB, date, and time of collection. A manual tube label must clearly identify the patient, the collector, and the collection timing. Full name, date of birth or other unique identifier, date, time, and phlebotomist initials support traceability. Insurance data, diagnosis codes, and physician phone numbers do not replace specimen identifiers. Question 64. What is the clinical term for small, red, pinpoint spots that appear on a patient's skin when a tourniquet is applied? Option A, hematoma. Option B, hemolysis. Option C, petechia. Option D, ichthyosis. The correct answer is option C, petechia. Petechia are tiny red or purple pinpoint spots caused by small capillary hemorrhages. They may appear when a tourniquet is applied to a patient with fragile capillaries or platelet problems. A hematoma is a larger collection of blood, while ichthyosis refers to broader bruising. Question 65. Why is it essential to allow the 70% isopropyl alcohol to dry completely on the skin before puncturing? Option A, to prevent the alcohol from evaporating too fast. Option B, to avoid hemolysis of the specimen and a stinging sensation for the patient. Option C. To ensure the vein does not roll during insertion. Option D. To maximize the chemical interaction with the tube additive. The correct answer is option B. To avoid hemolysis of the specimen and a stinging sensation for the patient. Alcohol must dry completely so it can disinfect effectively and avoid being carried into the puncture site. Wet alcohol can sting and may contribute to hemolysis or specimen contamination. Blowing on or fanning the site can recontaminate the area and should be avoided. Question 66. Which of the following tests is used to monitor a patient's heparin therapy? Option A. Prothrombin time, patient. Option B. Activated partial thromboplastin time, APTT. Option C. Hemoglobin A1c. Option D. Rheumatoid factor, RF. The correct answer is option B. Activated partial thromboplastin time, APTT. APTT evaluates the intrinsic pathway and is commonly used to monitor unfractionated heparin therapy. Heparin affects clotting factors measured by this pathway. Patient is more associated with warfarin monitoring, while HbA1c and rheumatoid factor are unrelated to heparin dosing. Question 67. What type of cleaning solution should be used to disinfect a phlebotomy tray on a daily basis? Option A. Concentrated isopropyl alcohol. Option B. A 1:10 dilution of household bleach or an EPA-approved hospital disinfectant. Option C. Warm water mixed with mineral oil. Option D. Liquid hand soap solution. The correct answer is option B. A 1:10 dilution of household bleach or an EPA-approved hospital disinfectant. Phlebotomy trays should be disinfected with a bleach dilution or EPA-approved hospital disinfectant. Daily and visible soil cleaning reduces transfer of bloodborne pathogens and environmental organisms. Water, mineral oil, or hand soap alone does not provide adequate surface disinfection. Question 68. What type of consent is given when a patient extends their arm and rolls up their sleeve for a blood draw? Option A. Informed consent. Option B. Expressed consent. Option C. Implied consent. Option D. Statutory consent. The correct answer is option C. Implied consent. Implied consent occurs when a patient cooperates through behavior rather than signing or verbally stating agreement. Extending the arm after the procedure is explained shows permission for a routine blood draw. Written informed consent is used for procedures with greater risk or more formal requirements. Question 69. What should a phlebotomist do if they observe small, red spots appearing on a patient's skin after applying a tourniquet? Option A. Remove the tourniquet immediately, as this indicates petechiae and potential bleeding issues. Option B. Tighten the tourniquet further to stop the spots from spreading. Option C. Ignore the spots, as they are a normal reaction to isopropyl alcohol. Option D. Rub the skin surface firmly to see if the spots disappear. The correct answer is option A. Remove the tourniquet immediately, as this indicates petechiae and potential bleeding issues. Petechiae after tourniquet application suggest fragile capillaries or a bleeding tendency. The tourniquet should be removed and the site reassessed before proceeding. Continuing pressure can worsen capillary bleeding and bruising. Question 70. What type of vessel links the arterial system directly to the capillary network paths? Option A. Arteriole. Option B. Venule. Option C. Vena cava. Option D. Deep vein. The correct answer is option A. Arteriole. Arterioles connect arteries to capillary beds and regulate blood flow into tissues. Their muscular walls can constrict or dilate to control local perfusion. Venules drain capillaries, and lymph ducts carry lymph rather than arterial blood. Question 71. What is the standard ratio of blood to anticoagulant additive in a light blue coagulation tube? Option A. 1:1. Option B. 5:1. Option C. 9:1. Option D. 10:1. The correct answer is option C. 9:1. Light blue coagulation tubes require a 9:1 blood to sodium citrate ratio. This ratio preserves clotting factor measurement without over-anticoagulating the sample. Underfilling the tube changes the ratio and can falsely prolong clotting results. Question 72. Which of the following tubes contains the anticoagulant lithium heparin? Option A. Light green top, PSD. Option B. Dark blue top. Option C, yellow top. Option D, gray top. The correct answer is option A, light green top, PSD. Light green plasma separator tubes commonly contain lithium heparin and a gel barrier for chemistry testing. Heparin prevents clotting so plasma can be separated quickly after centrifugation. Other tube colors are used for trace metals, cultures, glucose preservation, or coagulation testing. Question 73. If a patient experiences syncope during a venipuncture, what should the phlebotomist do first? Option A, call for an emergency code. Option B, complete the current tube collection. Option C, remove the tourniquet and needle immediately. Option D, place a cold compress on the patient's forehead. The correct answer is option C, remove the tourniquet and needle immediately. Syncope during venipuncture requires immediate protection from further injury. The tourniquet and needle should be removed first so bleeding and needle movement do not continue while the patient loses consciousness. Completing the tube collection is never the priority during a fainting episode. Question 74. What type of mask is required when entering a room designated for droplet precautions? Option A certified N95 respirator mask. Option B, a standard fluid-resistant surgical mask. Option C, a cloth face covering or scarf. Option D, no mask is required if you stay 2 feet away from the bed. The correct answer is option B, a standard fluid-resistant surgical mask. Droplet precautions require a standard fluid-resistant surgical mask when entering the patient's room or working close to the patient. The mask blocks larger respiratory droplets from reaching mucous membranes. N95 respirators are used for airborne precautions, not routine droplet isolation. Question 75. Which of the following factors can cause hemoconcentration during a blood collection procedure? Option A, leaving the tourniquet tied on the arm for 3 minutes while searching for a vein. Option B, releasing the tourniquet as soon as the first tube begins to fill with blood. Option C, utilizing a needle with a large lumen, such as a 21-gauge needle. Option D, having the patient remain in a supine position for 20 minutes before the draw. The correct answer is option A, leaving the tourniquet tied on the arm for 3 minutes while searching for a vein. Leaving a tourniquet on for several minutes causes venous stasis and fluid shifts out of the vessel. This concentrates cells and analytes, producing hemoconcentration. The tourniquet should be released within the recommended time and reapplied only after an appropriate pause if needed. Question 76. When performing a dermal puncture on an infant's heel, what is the maximum allowable depth to prevent osteomyelitis? Option A, 1.0 mm. Option B, 2.0 mm. Option C, 3.0 mm. Option D, 4.0 mm. The correct answer is option B, 2.0 mm. Newborn heel punctures must be shallow enough to avoid the calcaneus and deeper tissues. A maximum depth of 2.0 mm is used to reduce the risk of osteomyelitis and nerve or bone injury. Deeper lancets are unsafe for infants even if they appear to improve blood flow. Question 77. What is the function of the systemic circulatory system? Option A, moving blood exclusively between the heart and the lungs for gas exchange. Option B, routing oxygenated blood and nutrients from the heart out to the rest of the body tissue networks. Option C, filtering liquid waste products through the nephron beds of the kidneys. Option D, producing white blood cells within the flat bones of the axial skeleton. The correct answer is option B, routing oxygenated blood and nutrients from the heart out to the rest of the body tissue networks. Systemic circulation delivers oxygenated blood and nutrients from the left side of the heart to body tissues. It also returns deoxygenated blood and metabolic waste products back toward the right side of the heart. Pulmonary circulation is limited to blood flow between the heart and lungs. Question 78. Which of the following parameters can cause a false elevation in a patient's white blood cell count? Option A, collecting the sample while the patient is crying intensely or under extreme stress. Option B, chilling the specimen on an ice slurry before transport. Option C, protecting the collection tube from direct artificial room lights. Option D, allowing the serum to sit on the cells for more than 2 hours. The correct answer is option A, collecting the sample while the patient is crying intensely or under extreme stress. Extreme stress, crying, or intense physical exertion can temporarily elevate the white blood cell count. Stress hormones can shift leukocytes into circulation and make the value appear higher. Specimen chilling or light protection does not produce this physiologic leukocytosis. Question 79. What occurs when a phlebotomist shakes a blood collection tube vigorously instead of inverting it gently? Option A, hemoconcentration of the plasma. Option B, hemolysis of the red blood cells. Option C, complete inhibition of clotting factors. Option D, falsely elevated platelet counts. The correct answer is option B, hemolysis of the red blood cells. Vigorous shaking mechanically damages red blood cells and can cause hemolysis. Additive tubes should be mixed by gentle inversions so the additive distributes without cell rupture. Shaking does not improve clotting control and can make the specimen unsuitable for testing. Question 80. What type of collection is performed to screen for hidden blood in a stool specimen? Option A, occult blood test, GWARC. Option B, culture and sensitivity, C&S. Option C, DOVA and parasites, O&P. Option D, fecal fat quantification. The correct answer is option A, occult blood test, GWARC. An occult blood test, often using a GWARC method, screens stool for hidden blood. It can help detect gastrointestinal bleeding that is not visible. Culture, ova and parasite testing, and fecal fat analysis evaluate different stool conditions. Question 81. What type of transmission is prevented by wearing an N95 respirator when working with a patient who has active tuberculosis? Option A, droplet transmission. Option B, contact transmission. Option C, airborne transmission. Option D, vector-borne transmission. The correct answer is option C, airborne transmission. Active tuberculosis is spread by airborne droplet nuclei that can remain suspended in the air. An N95 respirator helps filter inhaled particles when entering an airborne isolation setting. Surgical masks are used for droplet precautions, and gowns or gloves address contact risks rather than airborne inhalation. Question 82. Which of the following can lead to a rejected specimen due to short draw? Option A, inverting a lavender tube 8 times. Option B, underfilling a light blue coagulation tube. Option C, using a 21 gauge needle on a large vein. Option D, drawing a serum separator tube before a green tube. The correct answer is option B, underfilling a light blue coagulation tube. A short draw in a light blue tube leaves too much citrate for the amount of blood collected. That imbalance can invalidate patient, INR, APTT, and other coagulation studies. Gentle inversion of a properly filled tube is expected and does not cause rejection. Question 83. Why should a phlebotomist avoid drawing blood from a paralyzed arm? Option A, the veins are too large and prone to exploding. Option B, the lack of muscle movement leads to poor circulation and potential thrombosis. Option C, the patient cannot feel if a nerve is being struck by the needle. Option D, paralyzed limbs do not contain white blood cells. The correct answer is option B, the lack of muscle movement leads to poor circulation and potential thrombosis. A paralyzed arm may have reduced circulation, impaired sensation, and increased risk of thrombosis or swelling. Specimens from that limb may not reflect normal circulating blood as reliably. Lack of pain sensation can also delay recognition of injury, but poor circulation is the main concern. Question 84. Which of the following procedures requires a strict chain of custody documentation form to accompany the sample? Option A, routine cholesterol screen. Option B, workplace drug testing. Option C, blood culture for endocarditis. Option D, complete blood count for anemia. The correct answer is option B, workplace drug testing. Workplace drug testing requires chain of custody documentation because results may have legal or employment consequences. The form tracks the specimen from collection through analysis and reporting. Routine cholesterol, CBC, or culture specimens do not usually require forensic level tracking. Question 85. What type of specimen is required for a plasma hemoglobin test? Option A, serum separator tube, SST. Option B, plain red top tube. Option C, heparinized or EDTA plasma free of hemolysis. Option D, whole blood collected in a gray top tube. The correct answer is option C, heparinized or EDTA plasma free of hemolysis. Plasma hemoglobin testing requires plasma that is not contaminated by hemolysis from collection trauma. Heparinized or EDTA plasma is used because anticoagulated blood can be centrifuged to separate plasma. Serum or visibly hemolyzed specimens can falsely affect the measurement. Question 86. What is the primary purpose of the multisample needle's rubber sleeve? Option A, to cushion the patient's vein from sudden movements. Option B, to prevent blood from leaking into the tube holder adapter between tube changes. Option C, to keep the needle sharp until it enters the vein. Option D, to guide the needle into the exact center of the vacuum tube. The correct answer is option B, to prevent blood from leaking into the tube holder adapter between tube changes. The rubber sleeve on a multisample needle seals the back end of the needle between tube changes. This prevents blood from leaking into the holder and reduces exposure risk. It does not guide the needle into the vein or protect the vein from movement. Question 87. Which of the following tests requires that the specimen be transported to the laboratory on an ice slurry immediately after collection? Option A, lactic acid and ammonia. Option B, cold agglutinins and cryoglobulins. Option C, bilirubin and vitamin B6. Option D, prothrombin patient. The correct answer is option A, lactic acid and ammonia. Lactic acid and ammonia specimens are commonly transported on an ice slurry to slow cellular metabolism and chemical change. Rapid chilling helps preserve the concentration present at collection. Warm transport or light protection is required for different special tests. Question 88. What type of consent occurs when a patient is fully informed of the risks, benefits, and alternatives of a procedure and signs a document? Option A, informed consent. Option B, implied consent. Option C, verbal consent. Option D, statutory consent. The correct answer is option A, informed consent. Informed consent occurs when a patient understands the procedure, risks, benefits, and alternatives and documents agreement. It is more formal than routine implied cooperation. Verbal or implied consent may be enough for many routine draws, but signed informed consent is used when required by policy. Question 89. Which gauge needle has the smallest lumen diameter? Option A, 18 gauge. Option B, 21 gauge. Option C, 23 gauge. Option D, 25 gauge. The correct answer is option D, 25 gauge. Needle gauge is inversely related to lumen size, so higher gauge numbers have smaller openings. A 25 gauge needle has the narrowest lumen among the listed sizes. Smaller lumens can increase hemolysis risk when used for routine venipuncture. Question 90. What is the primary reason for avoiding venipuncture on an arm with an active hematoma? Option A, the needle will cause the hematoma to spread to the opposite arm. Option B, the sample will be contaminated with hemolyzed, stagnant blood from outside the vein. Option C, the vacuum tubes will implode due to tissue density variations. Option D, it will cause immediate and permanent paralysis of the limb. The correct answer is option B, the sample will be contaminated with hemolyzed, stagnant blood from outside the vein. A hematoma contains pooled blood outside the vein that may be stagnant or hemolyzed. Drawing through or near it can contaminate the sample and worsen tissue injury. A different site, preferably the opposite arm, should be selected when possible. Question 91. What represents the correct order for removing personal protective equipment, PPE, after a procedure? Option A, gown, gloves, mask, goggles. Option B, gloves, goggles, gown, mask. Option C, mask, gown, goggles, gloves. Option D, goggles, mask, gloves, gown. The correct answer is option B, gloves, goggles, gown, mask. PPE is removed in a sequence that limits contamination of clean skin and clothing. Gloves are usually removed first because they are most contaminated, followed by eye protection, gown, and mask according to facility procedure. Removing the mask too early or touching the outside of contaminated PPE increases exposure risk. Question 92. Which of the following tubes should be collected last in the standard venipuncture order of draw? Option of light blue top. Option B, lavender top. Option C, grey top. Option D, green top. The correct answer is option C, grey top. Grey tubes are drawn near the end of the standard venipuncture order because fluoride and oxalate additives can interfere with other tests. Earlier tubes such as cultures, citrate, serum, heparin, and EDTA have higher priority in the sequence. Drawing grey tubes too early increases additive carryover risk. Question 93. Which department of the laboratory processes a comprehensive metabolic panel, CMP? Option A, hematology. Option B, microbiology. Option C, clinical chemistry. Option D, blood bank. The correct answer is option C, clinical chemistry. A comprehensive metabolic panel measures chemistry analytes such as electrolytes, glucose, kidney markers, proteins, and liver-associated enzymes. These tests are processed in clinical chemistry. Hematology, microbiology, and blood bank perform different categories of testing. Question 94. What is the correct action if a phlebotomist accidentally sticks themselves with a used needle? Option A, wash the site with soap and water and immediately report the incident to a supervisor. Option B, squeeze the wound to expel blood and apply a tight bandage. Option C, wait until the end of the shift to fill out an incident report. Option D, ask the patient if they have any blood-borne infectious diseases. The correct answer is option A, wash the site with soap and water and immediately report the incident to a supervisor. A needle stick exposure should be washed promptly with soap and water and reported immediately. Rapid reporting allows exposure evaluation, source testing when permitted, and timely post-exposure management. Squeezing the wound, delaying the report, or questioning the patient informally is not an adequate response. Question 95. What is the primary function of the anticoagulant EDTA? Option A, it enhances the action of thrombin. Option B, it binds calcium ions, preventing the clotting cascade from activating. Option C, it destroys white blood cells to preserve red cells. Option D, it stabilizes glucose levels by stopping cellular glycolysis. The correct answer is option B, it binds calcium ions, preventing the clotting cascade from activating. EDTA binds calcium ions and prevents the coagulation cascade from progressing. This preserves whole blood for hematology testing and maintains cell morphology. It does not preserve glucose or accelerate clotting. Question 96. Which of the following infections is considered the most common nosocomial risk for healthcare workers handling blood? Option A, human immunodeficiency virus, HIV. Option B, hepatitis B virus, HBV. Option C, tuberculosis, TB. Option D, malaria. The correct answer is option B, hepatitis B virus, HBV. Hepatitis B has historically been a major occupational concern for workers exposed to blood because it is efficiently transmitted by percutaneous injury. Vaccination reduces risk, but exposure prevention remains essential. HIV, tuberculosis, and malaria require appropriate precautions, yet they are not the most common blood-handling nosocomial risk in this context. Question 97. What is the major drawback of using a needle with a gauge size of 25 or higher for venipuncture? Option A, it causes severe tissue tearing upon skin entry. Option B, it carries an extremely high risk of causing hemolysis in the sample. Option C, it penetrates too deeply into the bacillic structures. Option D, vacuum tubes will lose their suction pressure entirely. The correct answer is option B. It carries an extremely high risk of causing hemolysis in the sample. Very small needles, such as 25 gauge or higher, can damage red cells as blood is forced through a narrow lumen. This increases hemolysis risk and may compromise chemistry results. Larger needles are not always appropriate, but extremely small gauges are avoided for routine venipuncture. Question 98. Which of the following additives is found in a green top tube and works by inhibiting the action of thrombin in the clotting process? Option A, sodium citrate. Option B, DDTA. Option C, heparin, lithium, ammonium, or sodium. Option D, potassium oxalate. The correct answer is option C, heparin, lithium, ammonium, or sodium. Green top tubes contain heparin, which prevents clotting by enhancing antithrombin activity and inhibiting thrombin. Lithium, sodium, and ammonium heparin are selected based on test requirements. Citrate, EDTA, and oxalate prevent clotting by binding or precipitating calcium. Question 99. A phlebotomist must collect a cold agglutinin sample. How must this specimen be transported to the lab? Option A, chilled on a slurry of ice and water. Option B, maintained at body temperature, 37 degrees Celsius. Option C, protected entirely from light exposure. Option D, frozen immediately in dry ice. The correct answer is option B, maintained at body temperature, 37 degrees Celsius. Cold agglutinin specimens must be kept warm because the antibodies can react at lower temperatures and alter the sample. Maintaining body temperature helps preserve the specimen condition needed for accurate testing. Chilling or freezing would encourage the very reaction the test handling is designed to avoid. Question 100. A serum separator tube, SST, contains an additive that assists in what process? Option A, preventing coagulation. Option B, accelerating coagulation. Option C, inhibiting glycolysis. Option D, preserving blood cultures. The correct answer is option B, accelerating coagulation. Serum separator tubes contain a clot activator that speeds the formation of a clot before centrifugation. After clotting, the gel barrier separates serum from blood cells during spinning. Anticoagulants prevent clotting, so they would not produce serum in the same way.